you're a school bus driver. You're supposed to pick up 10 students on your route, but when you get to school, you turn around and find that there are only 4 students on the bus. 6 of the students that you were responsible for are still waiting for you on street corners throughout the city. Now imagine that bus driver is our health system. And these students left behind are the over 6,000 patients at Penn Medicine who are at risk for hepatocellular carcinoma, also known as HCC or liver cancer. In order to catch this cancer at a treatable stage, patients with chronic liver disease should be screened every 6 months with an abdominal ultrasound. Research shows that the 5-year relative survival drops significantly after early stage diagnosis, down to only 2.4%. Frequent screenings are critical in being able to diagnose and treat this cancer. The problem is 60% of patients are diagnosed too late to be cured. I'd like to tell you a real story. Meet Sam, a patient at Penn Medicine who was one of those 60%. Sam had cirrhosis, among other medical concerns, and over the span of 3 years, she had been seeing her primary care physician, Dr. Swift, in preparation for a major surgery. But over those 3 years, she only made it to 2 appointments with her hepatologist, Dr. West. When we looked back at Sam's story, we discovered that she was occasionally reminded by her physicians to get her HCC screening done. But we also discovered missed appointments and opportunities to have had the screenings ordered. By the time Sam finally got an ultrasound done years later, she was diagnosed with late-stage HCC. Everyone was devastated. For primary care physicians in particular, keeping track of at-risk patients like Sam is like keeping track of a needle in a haystack. To highlight this, 560 is the actual number of patients cared for by one of our primary care physicians. Yet only 1 is eligible for HCC screening. As a physician, imagine having to remember a task that takes up only 0.002% of your workload. But for this one patient, it's everything. This isn't an isolated case, as the majority of Penn primary care physicians face this almost insurmountable task. There are many reasons as to why staying on time with screening is difficult. First, it's not easy to know who's eligible. There are more than 20 factors that could make a patient eligible for HCC screening. Not only is it hard to know who's eligible, but there are also competing medical concerns that a physician has to prioritize within a visit, so screening may fall to the wayside. Within the past year, PCPs and hepatologists only placed orders for 60% of their eligible patients, leaving the other 40% behind on their 6-month screening schedule. And lastly, there are competing needs on the patient side that make it difficult to follow through with screening, such as cost, inconvenience, and other more pressing medical needs. As we've seen, no one person is at fault for a patient falling through the cracks. This is a multi-layered problem that needs a multi-pronged solution. A suite of solutions, in fact, that eliminates the burden on physicians to know who's eligible for screening, makes it easy for physicians to do the right thing, and makes it easy for patients to follow through with screening. We call this suite of solutions LiveAware. I'm Tessa Cook, I'm a radiologist here at Penn Medicine, and I'm going to tell you about LiveAware, our HCC screening and navigation platform. First of all, how did we eliminate the burden on physicians to know who's eligible for screening? There's currently no registry built to identify these patients, so our team tried to identify them on our own by creating a dashboard. As we went through the various iterations, we discovered that properly identifying these patients is not as simple as plugging in one diagnosis code. It requires analysis of multiple pieces of information that live in different parts of the patient's record. This dashboard was used by our team to identify the right patients for our interventions and informed how we might build a registry in the future. Next, LiveAware sought to increase the overall number of orders placed by removing the burden of remembering to order the screening while addressing competing priorities during a visit, thereby making the right choice the easy choice. A LiveAware team member would do the heavy lifting of creating a pending order which would then present itself within Epic and trigger the physician to sign. And because we made orders standing orders, the physicians don't have to worry about signing another order again for the next 6-month screening. With our dashboard, we looked at 11 physicians over 1 month and identified 23 of their patients who were eligible and due for screening. After pending orders for these patients, we learned that our dashboard isn't perfect. Physicians identified 6 patients who didn't need to be screened. Of those that were appropriate, 3 patients' orders were missed. This made us realize that we need to think about different ways of notifying physicians of patients' eligibility for screening. To date, 14 of the orders LiveAware has placed have been signed by physicians. That means 82% of orders that we pended were signed. 5 of those patients had screenings that would otherwise not have been ordered. These are our catches. Our intervention resulted in a 22% increase in screenings ordered from our baseline. Primary care physicians loved the system and the increase. This is an example of one of our catches, where the physician mentioned they likely wouldn't have placed the order had it not been for LiveAware. At the system level, LiveAware can catch over 2,000 patients at risk for HCC within Penn Medicine who might otherwise be missed. A big part of the friction to getting screenings completed is the fact that patients have to show up to their appointments to get screenings ordered. To remove this reliance on appointments, the LiveAware team had physicians preemptively sign orders and engaged patients through My Penn Medicine and phone calls. For those patients that did show up to appointments, LiveAware piloted bundling same-day screenings with the appointments. The 3 patients who were offered same-day screenings completed them. And 1 patient indicated that they would have skipped their screening otherwise. We've made great progress in solving this problem and have a long road ahead of us. But what does it look like when we get this right? That's 1 more screening done, which potentially prevents another story like Sam's. LiveAware can benefit the other 6,000 Penn Medicine patients like her. By ensuring patients get screened every 6 months, we can reduce the number of late-stage diagnoses and improve outcomes. Besides patients, LiveAware benefits physicians, payers, and Penn Medicine. We know LiveAware offloads the cognitive burden of identifying eligible patients from physicians. We can benefit payers by reducing the expensive downstream care necessary to treat late-stage HCC. And we know that by reducing the number of late-stage diagnoses and increasing the number of early-stage diagnoses, the health system can benefit from larger contribution margins for the procedures done when we catch and treat early-stage HCC. LiveAware doesn't just help the 6,000 patients at risk for HCC. We can navigate other complicated screenings for diseases such as colorectal cancer and polyposis syndromes, aortic aneurysms, breast cancer in patients with first-degree relatives, lung cancer, and many more. The possibilities are endless. I would like to acknowledge the incredible team with whom I've had the privilege of working on this initiative, from radiology to hepatology to primary care, and in particular the talented team at the Penn Center for Healthcare Innovation. Thank you.